We can treat aneurysms using minimal invasive surgery, and that is basically gaining access to the blood vessel using ultrasound guidance with a needle or a small incision, then placing catheters and wires through the blood vessel into the aneurysm, and then placing a covered stent to exclude that aneurysm from the circulation. Even though we can treat a lot of aneurysms using endovascular repair, sometimes some aneurysms are very complex and need the traditional open repair. And that entails opening up the body either through a midline incision or a flank incision or the chest to gain access to the aneurysm, and then replacing that aneurysm with a piece of dacron or a piece of graft. After endovascular repair of the aortic aneurysm, most patients need lifetime follow-up. Roughly 9 out of 10 patients need no more operation. About 1 in 10 patients need some kind of follow-up, some kind of repair. Most of the time we could do it also endovascularly.